Improving Access to Care by Rachael Green. Legal. There are millions of Americans who have no health insurance and can't afford to pay for health care. There are also people who pay out of pocket for health care and can't always afford to pay out of pocket for it. And they may only go to the doctor's office when it's extremely necessary. Some people that may even die every day because they fall short of receiving the proper care they need. There can be copays associated with insurances, and some people may not even be able to pay their copay. Some healthcare needs turn into bigger healthcare problems just because they go untreated. There are programs like Medicaid and Children's Health Insurance Program that provide health coverage for so many people all across the world, and they may not have had it otherwise. Through these programs, um, they support access to care in many ways. Most importantly, people gain access to healthcare services that they need. And in addition, there are programs and benefits in many areas where there are low income families, such as network and payment methods that help ensure services are accessible for patients. Ethical. There are differences in access to healthcare across different populations, and these different populations is the main reason for existing limitations and disparities in healthcare provisions. These differences occur for several reasons, and some of them may contribute to the problem in the United States of access to care. Some elder people may struggle getting to and from the doctor. They may struggle with getting the prescriptions that they need. There also may be conflict or a misunderstanding in regards to communicating, whether it is about the health care treatment plan or prescriptions or a patient's health in general, but language barriers can cause problems. Um, there are patients who may need a specific treatment, and their doctor or physician is just not available in the specific area that their insurance company may cover. Um, so there are problems that some patients can't go around, and they just have to go where their insurance says they can go, which is hard. It creates difficulty in just everyday commuting or their life day in and day out. Liability and risk. There are liability and risk involved in every aspect of healthcare. The access to healthcare creates even bigger problems, legal issues. Um, Low income families experience legal barriers, for instance, and when it comes to the inability to pay for coverage or prescriptions they may need or specific doctor's appointments that they may need, because they just simply don't have the funds to pay for the services. In addition, they can't afford some of the bills that they may have due to not having any health coverage at all. Um, this can be difficult for one who may depend on a specific medication, and they just may struggle with getting that medication that they need on a day to day basis just because they don't have the funds. And to go without the medication may cause serious health problems or even lead to death, which is um, not as rare as you would think. I mean, people actually die from going untreated due to no insurance or lack of health care insurance. So they have these untreated health problems and they create bigger problems. And that's not always safe, it's very risky. So, to avoid these, people should try to communicate with the physician as to the best resources due to their insurance just to reduce bottlenecks and bigger problems in the end or having to pay out of pocket in general. Management resources. Um, the access to care, there's a lot of things that cannot be changed. There is the medical field and there's the legal field. And sometimes they all don't align together to create the best result or outcome. And it could be um, it could be difficult, but I feel as though if we work together, if the medical field and legal field could work together and just try to do the best we can to save people's lives, that is always a positive thing. Innovation and communication. People are researching consistently on different ways hospitals can improve healthcare access just to better patients and organizations in general. Hospitals being able to, for instance, have the ability to add additional transportation for patients to get to and from the hospital could, be life saving for a patient who couldn't get there. So things like that, just being more creative on ways to help people when they are kind of in a bind and they need help or further options to be able to better themselves and better their health. Prioritizing patients' needs first as opposed to um, it being a financial um, situation before you can be seen or treated. Um, so that's very serious because everyone can't afford um, health procedures that they need. And sometimes not having the financial means can stop someone from not having the treatment that they need. Patient centered care. So many of the challenges facing healthcare systems in the future will be related to overall challenges of balancing the quality and safety with the efficiency of physicians and healthcare providers or administrators in general, people in the healthcare industry. So patients' needs always come first, and patient-centered care is an individual's specific health needs and desired health outcomes, and it's the driving force behind all healthcare decisions and quality measures in that patient's life. So it's tailored to them and their needs specifically. Patients are partnered with their healthcare providers, and providers treat patients not only from a clinical perspective, but also from an emotional, mental, spiritual, social, and financial perspective. So all aspects of that patient's life is pretty much covered so they can be fully devoted and committed and focused on the healthcare treatment plan in general. It's important that physicians and patients and families can actively collaborate together and make decisions together and share these decisions between the patient and the family to provide the best outcome and to manage the treatment from beginning to end to have the best care plan and the best outcome. In general, patients, they have the right to know exactly what their healthcare treatment plan is. So making sure that they know and talking to them, communicating that to them fully is important. Um, Um, at this time, I would like to thank you for the opportunity to present my access to care, and I would like to open up for any discussions at this time. Thank you.